Listen, look at this. I'm here with Chris, aka Bulky Bilk, and she bulldog sometimes.
Cash money.
Cash no money.
Yeah.
So
Crypto cash.
what I'm about to do here, I asked Chris for a little information. For one, what drugs, aka we won't call them drugs, but
Yes,
that's what
please
they
don't.
are. What medications do you believe that most people should have in their home when they are breeding, or just to protect their dogs if something is to occur? And walk them through what each one of them do if you can.
These are just worm medicines. They're preventatives. They will do. I have a cheat sheet. I got a cheat sheet, man.
That's good. Look, I write everything down too. You're supposed to. It makes things
I got a
easier. Everybody
cheat
got to
sheet.
remember all this crap.
I mean, it's not even that I don't remember it. I just have a cheat sheet for my own use, and it helps me. What each one does, not what each one does, but that's for heart rates. Sorry. I have one for worms. There's 3 of them,
For worms, Safeguard.
and Falbazin is the last one. There's a 3rd one. There's Safeguard, Panicure, and Falbazin. They're sisters.
Okay, so
They call them sisters.
But why is it? Why do you need all 3 of them versus just one of them?
You don't need all 3 of them. That's I'm just telling you. There is 3 of them.
Okay.
Falbazin, a lot of people don't use it because it's been studied that it can cause sterilization. In
Yeah, it'll
animals.
sterilize a dog, basically. Dog.
45 days.
So basically, if you got a female, you run some problems for dang sure. And a boy, he's gonna be shooting dust.
Well, I don't know the scientific. I don't know the scientific answer for you. Honestly, I don't. So I don't use Falbazin. And then you have your Strongyne. I have it too. I just didn't grab it.
Yeah.
You know, these 2, they do hookworms, roundworm, whipworms, and Giardia.
Okay. That's Panicure.
Yeah, Panicure,
Giardia,
Safeguard. They're the same. I mean, vet's going to give you Panicure. That's what they're going to give you.
For Giardia.
Yeah, they can give it to you for Giardia. Yeah.
What's the best solution for Giardia?
I wouldn't call it the best solution. There's other solutions.
Yeah.
You can use. What's the yellow one, Gina, that we don't really use anymore? It tastes like
Albon.
Albon. I'm gonna say tastes like cake.
You tasted it.
Unfortunately, you can use Albon. They have Baycox, aka Tortazerol, I think is the name of it. The scientific name of it in the Plums book. Or the Merrick book, whatever book you're using.
Yeah, I got the Plums one you told me.
These are just your generic cephalexin. I'm not going to tell you what they're for because I don't want to get in any trouble. You know
Yeah,
what I mean?
guys, now mind you, cephalexin, the doctor gives it to you. I would tell you this, I come from healthcare space. So what happens is people don't ever actually read what's going on. They just do what the doctor says.
Yeah.
When you're dealing with dogs, you might have some leftover cephalexin at times, which could benefit another dog.
These are your 2. I brought these 2 because these are your 2 cheapest drugs.
Yeah.
I'm not trying to say people are cheap, but these are your 2 cheapest drugs. And they're broad spectrum antibiotics.
Okay. Moxicillin, that's the one?
Yeah, amoxicillin and cephalexin. Cephalexin, a lot of vets use because they can't build up a resistance to it.
They can't.
Cannot.
Okay.
And this is 1st generation. I believe they're on 3rd generation right now. So I don't really know what that means, but hey, I know what the book says. I think cepidoxine is like 3rd generation. Don't quote me on that one. I'm not 100% sure. Metro, this is good to have for diarrhea. Or coccidia. It cures coccidia. And this is Clavamox. If you ever had a female, you've probably been a UTI or something like that. You've been given Clavamox. And this is just, I have. These are Dronto Plus pills. I have them formulated by my veterinarian, and he sells me the whole bottle. Dronto Plus is probably one of the best wormers on the. It's single dose wormer, and then 2 weeks later you do another single dose. Where this is 3-day or 7-day treatments. 3-day for preventative, 7-day for treatment.
Daddy.
Listen, my man. Go get mommy. So, I prefer this when I send puppies home to make sure they're nice and clean. And
that's the Dronto.
Yeah, Dronto Plus. I mean, these are just a few of the simple drugs or medications that I use. I mean, I use doxycycline, I use Albon. I mean,
he's got a medicine cabinet, but here's the thing, guys. You got to, before you get drug happy, and I got to call them drugs because some of the ways in which these people are using them are straight up like drugs. You get frightened or spooked by something your dog did. You read somewhere but don't read the label, and then I'll tell you this. Let me get over here so you guys can see me. Get in this shot with Chris. I was at an event shooting, and for those that know, I've done many things with Ruben specific to medication. Ruben called me. He was perturbed. He was distraught. And what a guy did that he knows, so I won't call his name off, and I don't know him no way. But he said the guy basically gave the puppies, 6-week-old puppies, I believe, if not, it may have been 5 weeks, Frenchies, basically a dose like you would give a dose to a cow of penicillin.
because he probably bought cattle grade. So like for an example, what he's implying is we'll use Baytril.
Yeah.
Injectable Baytril comes in 2.5%, 5%, and 10%, I believe. I think those are the 3 doses. Injectable. 10% is for large animal, for cattle. The 1.5 or the 2.5 is for small animal. So if you read the dosing, it gives you mg per kg based off of the animal that it's prescribed for.
And the penicillin that the guy gave this person was per 100 pounds, and there is no Frenchie on earth that should ever get 100 pounds or will be alive at 100 pounds.
Well, see, a lot of people don't know that, like, for an example, we'll just take this one for an example. This is a 500 milligram tablet capsule.
Yeah.
So if you look in the Plum's book, better yet, I know this one by heart. Metro's is 20 to 30 mg per kg, or 15, I think it's 15 to 30 mg per kg. You know what I mean? Mm-hmm. So you do your weight, you have to transfer it over to kilograms, which is you divide it by 2.2. Yeah. Then you times it by whatever the dosage says, which is say it's 10.
It's arithmetic that most of you ain't doing, this to be clear.
So then you divide it by the 500. And that's what he didn't do. He didn't divide it by the 100 because it was for large animals.
And there's the arithmetic part that can get frustrating, but most importantly, you've got to read the labels. So when we're looking at solving problems, and I've got this question, I stopped doing a lot of Frenchie talk because, hey, can you do more? I'm like, look, I don't want to talk about all the problems you guys are dealing with. Because the first thing when we did quite a few lives was, hey, what medication? What about this? I'm like, yo, y'all need that much medicine?
Well, that's why I don't like being in the medicine space for people. Because they think it's like an easy way not to have to go to the vet.
That part too.
I mean, I go to the vet. Why should I have to pay the vet just to say hi to him is $65.
Every time, man. That's why I hold them bills up and show y'all, listen.
Why shouldn't you have to pay the same $65?
At least. And then you still have 20 years of experience in education and learning, and still learning, to be clear, we all are, which means, well, for one, the goal is to protect the dogs at all costs, but also, cut costs. And if you got a vet like he has, my vets want me to know, and even my vet, Dr. Barnett, she'll say, hey, if you got it, just give it this. I got to say, oh, perfect. She'll literally write out exactly how much to give the dogs because she's not opposed to you being in control in the best way possible of what you're doing if you are a breeder. So I often tell people too, if you can find a good repro vet, that could make or break your program at times.
Yeah, you can. Not only that though, I prefer large animal vets personally.
You do?
Yeah, large animal vets are a little bit more lenient with medicine.
As far as like, hey, you can take this with you.
Well, not only that, they're just they're so used to cattle. People who do cattle, they have all this on hand. This is over the counter. You can buy this over the counter.
Yeah, Panicare is one of the ones you can buy.
So they won't get all.
And I use Pyrantel a lot of times for the worm. You can buy it on Amazon.
Yeah.
All this stuff.
And they some vets, they want to put it in a syringe and sell it to you. Where large animal vet, hey, you need a bottle? Whoop, and they'll throw you the whole bottle. You know what I mean?
Yeah.
So I prefer large animals because they know that our livelihood is based off of the care of these animals. Mm-hmm. Well, I'm not saying that small animal vets don't do it, but that's how they make their money for every single thing that they charge us for.
Yeah, and trust me, the check gets run up. I know you paid quite a bit, and I told somebody before, I'm $8,000 in on legs. I said we broke a leg at TPLO, that's 5 and 3 right there. And I think it was a little bit more. My vet came out. I think he felt bad. He goes, I'm going to stick to the quote I gave you. just because it gets expensive. Plus, the dog got to get on medicine and some other stuff just to deal with pain, inflammation. Which, again, you don't want to give no dog no ibuprofen and no damn Advil. I know that because it'll cause all types of issues. Yeah, in the dog's stomach, to be clear.
I don't use either one, so I don't know.
Yeah, well, I'm telling you from experience, Flex swallowed half a bottle of Advil, and we'll just put it like this: it almost killed him.
Yeah, I know what it could do, but I just don't.
Yeah, no, and of all the things in the room, that's the one thing he wanted to chew on. So a lot of fluids,
It was funny because that kind of stuff will kill him, but he can eat a bag of weed and be higher than gas for 2 days, but he'd be cool.
That's the boy. I tell you, and so I would say if you are thinking about breeding, learn as much as you can, which is again what this channel is about. Some of these things are very basic. Objectively, if you have a good vet, you should be able to get some of these things. Just have them at the house. Make sure before you get anything out your house that is drug or medicine related that you understand its usability, how it could affect the dog long term. Hey, can I ask you this too? Are there any drugs that people should be mindful of that could kill pups? They're superstitious. So for instance, a guy says, hey, a buddy of mine dewormed his female 2 weeks before, but lost all the pups. Why would that take place?
I mean, for the most part, wormers are pretty safe. I mean, that's why the name of it's Safeguard. It's pretty safe, man. Yeah. I mean, yeah, you can give them diarrhea by overworming them. I mean, you literally would have to give them. Whew.
And to be clear, I've read. I know he told me.
I've done it. In the beginning, I thought I had. So the bottle, I've had a dog chew an entire bottle up. And I was like, yo, this dog's I thought he was gonna do something to him. I run him to the vet. She said, well, how much did he eat?
A lot.
I don't know, the bottle empty. And well, just keep an eye on him. We'll leave him here. If he needs fluids, we'll see how his stool.
And that was just a wormer?
Yeah, he had a whole bottle of wormer. I mean, he had some really loose stool. But he was perfectly fine, and it was a puppy. It was a young puppy. It wasn't an older puppy. It wasn't a 10-month-old puppy. It was probably a 3-month-old puppy.
Yeah.
I mean, some drugs, they're okay. I would tell you if anything like that happens, just contact the vet, because there is drugs that are harmful and that needs to be offset sometimes. You know what I mean? So I don't know what they are. I'm not in that space. I would just tell you, if you don't know what they ate, take them to the vet.
Yeah, there you go. So at anywho, it's not a lot of drugs to be super concerned about. Are there any drugs that you should never give a pregnant female?
A pregnant female?
Yeah.
Yeah, there's quite a bit of them.
Just your top 3.
I don't know.
Here's one. What about vaccinating your female if she's pregnant? Or about to be bred?
I don't know about that one either. They don't recommend it.
I do it. I would do it.
I don't recommend it.
So we got a no vaccine before the pups.
I mean, I don't know the textbook answer, so I don't want to talk about it because I don't know it.
And I'm
I
the
do
same
it once
way.
a month. Once a year, so that's all I do.
And you give a 5-in-1?
No, I do a lepto now because I'm out in the woods, but I vaccinate for rabies because I have to for the state.
So rabies and lepto once a year for your dogs. Those are the top 2 you do after you.
If you're starting lepto, if you haven't done lepto, you can ask Ruben. It's a 2-shot series in the beginning. Step 1, step 2, and then every year after that is a booster. So you can't just give one for the very first time and think you're cool. It's a 2-step in the beginning, and then from there on out, it's a booster. So, you might want to clarify that one with.
No. The doctors, the Barnett and the military, you got to boost that one per se.
The first one boost. The second one after that is once a year to boost it.
Okay.
I don't know. I don't know medicine off the top of my head like that. Which ones are, which ones are no good? I had to look it up.
Yeah.
And it tells you in the plums.
Which ones not to get. So guys, Plumber's Guide for dogs. Plums. I have one at the crib. It looks like the Holy Bible, but bigger. And it's about $100. You can get it off Amazon. And I don't remember what edition it was, but
ninth, I think. Ninth
yeah, whichever the newest one is, it's available.
Hold on, no. Check this one out, right? You're gonna like this.
Yeah, you gonna show? I'm gonna sit back down.
No, look. Where's it at? Damn. I know I had. My son probably erased it. There it is.
Oh.
You can get it right on your phone now.
There you go. Now it's
There's a plums application too. My kid must have erased it because I have the book too. So
So
You can download it on your phone. It's an app.
So, but look, let's finish it off with this.
See?
There you go, Plums. Let's finish it off with this, people. And this is something to think about. So what are the top 3 things on average a house or a person's going to deal with in their home? Outside of potentially UTIs, worms at times. What's another one they can do? Diarrhea is probably huge.
Yeah, fleas.
Fleas and ticks.
Yes.
Those are the things that you probably want to keep as far as medication concerned.
Well, no, I recommend just being on a preventative for flea and tick. Your side effect to fleas is tapeworms, and it's a side effect to it.
So if you get fleas, if the
They
dog
eat them and they ingest them, they can get tapeworms out of it.
Oh wow.
And Heart Guard will help you for your heartworms, for your mosquito bites and stuff like that. Well, tick bites, your tick-borne diseases, I mean, you're better off keeping them on preventative, to be truthfully honest.
As far as heartworm is concerned.
No, tick is a different medicine.
So
Tick is
flea
like,
tick, because tick will lead to Lyme disease and a bunch of other things.
yeah, tick is Lyme disease, and they have blood-borne diseases within Lyme. So there's more than just one Lyme disease. I don't know them all. I think there's 4 of them.
Sheesh.
So I mean, yeah, that's just one of those things that you got to be mindful of.
That's crazy. That's crazy. Food for thought, people. Well, for now, look, those are some light medications that we recommend you having. Make sure you do your homework, to say the least.
Yeah.
You've got no percentages, no this, no that. Meaning we didn't tell you what to do, what to give. We just recommended some ideas on especially if you're running a kennel and you got quite a few dogs. Some of this stuff can save you some money, but the most important part that can save you time and money is the educational component. Yeah. So the more you know, the better you can do for your dog.
Yeah.
All right, people, stay tuned. Take care of your dogs.